Good afternoon. Good afternoon, everybody. I would like to welcome you to our health show. This is TTI, standing for True Temperance International. And my co-host is
Charlene. Good afternoon, everyone, and thank you for joining us.
Thank you, Charlene. And our speaker today is Dr. Travis Tramel. Can you just say hi, Travis?
Hi, everyone.
Okay, now if you didn't pick up his accent, he's not from the UK, he's international and he's coming from America. I'm going to give you a little bit more information about him later, but also I'm going to ask him to give a bit of information about himself, but we'll come back to that in a bit. So I'd like to welcome everybody who's joined us from various different places, whether it be South Africa or it might be Australia or wherever. I would just like to give you a big welcome and thank you for joining us today. Also, I'd just like to say that last week or this week, we've hit 1,000 of people are associated with us on YouTube. Subscribe, that's it. I was to subscribe to it. So I'm really, really pleased. I'm really, really looking forward to the topic today. I think it should be very, very interesting. Very, very interesting. I think Travis has got some big shoes to fill, but I think he can do it. I really, really do. So, Shirley, would you like to read the disclaimer for us, please?
Yes, that's fine. Again. Yes, I'll read the disclaimer.
All right. Okay, let's see. Can you see that?
Yeah, I can see it. That's fine.
Okay.
Okay, so only a physician can diagnose, treat, and prescribe for illness or disease. Any information disclosed or discussed at the TTI Zoom talk show are for educational and informational purposes only. Please continue to seek professional medical advice from your general practitioner regarding any illness or disease you may be suffering from.
Okay, and while we're here, because we want to jump into the program, give Travis as much time as possible, we're just going to go through some slides now. Shirley, if you can talk to the slides of what's up and coming and anything that we're going to be advertising, okay?
Okay. So this is for today. Your mouth is in good hands. Presenter, Dr. Travis Tramel, and we thank him for joining us on the TTI Family Health Show. So that is for today. Next week, Edgar, what will be happening next week?
Okay, oh, all right, that's me, right. We will be looking at challenges that because we've been running for over a year now, and that's another opportunity for me to promote YouTube. All of our programs that we've done are on YouTube. So if you've missed anything, you can go onto YouTube and look at the various programs, the wonderful speakers that we've had. But what we're going to do next week is all of us in TTI, well, maybe not all of us, but most of us are going to look at a challenge that we have given to people throughout the year and probably pinpoint a few things and kind of have a discussion about it and maybe even run through as a practical some of the challenges that we've done throughout last year, this year. So that's something that's going to happen next week. Yeah. Okay. Next one. Oh, that's the same thing.
Okay, so This is for those who are really on YouTube, our YouTube family. So this is our URL links for our Telegram groups. So we have a women's one, a men's one, and then we have a spiritual health one. So on the women's and men's, this is where we discuss about health issues. It may be the challenges that we've set, if anyone's struggling, any questions that people may have regarding health. That's on the women and men's group. And then the spiritual Telegram group, that's where we have the devotionals, the spiritual encouragements. When it comes to prayer, anything to do with spiritual health, that's where we would discuss on that platform. So this is the URL for those who are on YouTube. Those who are on Zoom, we will post it in the chat if you wish to join us.
Okay, before I go to the next slide, I would also say that we'll talk about this a little bit later, but we're planning to have a break. TTI, we're going to have a break, but it's important to make a note of the particular platforms that Shannon has just mentioned, because the platforms won't be closed, so people can still get in contact with us and send us messages and so on. But the show is going to take a break for a few weeks. So just be aware of that platform. I'm just going to go back a little bit, because on the one that was the last one, we want you to think about the challenges that we would like you to do, which we'll obviously promote next week. But also, while we're off, we want you to think about challenges that you can do as well. So that's just a little snippet. If you look at the top, you've got cayenne pepper, putting more cayenne pepper into your meals and so on, which increases blood flow and so on. Exercise, we know exercise is good. Hydrotherapy, hot and cold, again, it helps your immune system. And as nice as it is at the moment, we'll soon be heading into the winter period with colds and flus and so on and so on. So you need to think about your immune system. So that's just something to think about for our program for next week, but also as we're going ahead. Yeah. I'll go to the next one, Shirley.
Okay. So this one is thank you to everyone that has supported us, whether it's through sharing the links, our TTI showed the links with friends and family, even with strangers, the donations that we've had, the prayers that we've had, the words of encouragement that we've had. So this is just a thank you section, just to say thank you, each and every one of you, for supporting us, for joining us on YouTube, on Zoom, and being a part of the family. So on Tuesdays, we have at 7 o'clock our Bible study presented by Lewis and Alvin, who's part of the team. So they're going through character building in the sanctuary. So that's every Tuesday at 7 o'clock. And I'm not sure if anyone can see that, but the meeting ID, if you wish to take it down, is 869-8935. What's that again? 8138. And then the passcode is 861932N, capital N, capital J. And then on a Thursday at 7, myself, Samantha, Sharon, and Alvin, we do an essential oil class. And this is not for this Thursday. Last Thursday gone, we had one hydrate with a twist. So nice waters. So if you just don't want to drink plain old water, a nice twist of what you can put in there, an essential oil that's internal, the ones that we use to make your water have some flavor and be nice, but also benefit you internally. So we had a nice practical session afterwards, after the talk, the presentation. But this week, we're going to follow in Dr. Travis's footsteps, And we're going to talk about oral health Thursday coming. So oral health with a practical of toothpaste and what we can use, and some other different things. I'm not going to spoil it. So different things when it comes to oral health and using the oils. And then this Tuesday from AHR, it will be Tuesday the 27th. We had Marcia speak to us 2 weeks ago. I think it was 2 weeks ago, Edgar, wasn't it? 2 weeks ago about CBD, not CBD, what was it? Well, you can say that chickweed, burdock, and dandelion. Those were the herbs that we mentioned, that Marcia mentioned to us. And this week she's going to be on the AHR platform, where she's going to do herb safety and efficacy. So she'll be there, but please make contact with AHR regarding it, as there is a fee as well. So please contact AHR and they'll be able to discuss with you further if you want more information, and also the cost involved to take part on Tuesday the 27th. So that's Tuesday coming. But if you go on our YouTube page, you will see Marcia presenting, and it was an excellent presentation and what she did and with the herbs. And then we have Manor House. Manor House, they're no stranger neither. So Lucille has spoken to us when it comes to constipation, high blood pressure. She runs a lifestyle center in Stoke-on-Trent. And August the 29th to September the 8th, they have Restore to Health 10-day residential program. And this is preparing your bodies for the winter coming, well, for the flu season, and building your immune system. So winter ready, that was the question. And I have a residential coming up August 29th to September 8th. So please make contact with Manor House also. manorhousehealth.co.uk, the website where you can go and get the contact information for them, because I can't really see it down here, unless Lucille can put it in, or Joan can put it into the chat as well, to contact them via phone. Oh, it's right there, actually. So you can contact Joan on 079 4907 2676. And then the email address as well. Thank you, Edgar.
Sorry about that. I'm just having a few technical issues. Thank you very much, Shirley. Just to remind everybody that if you do go to Manor House, please, and you heard it from TTI, please give us a mention that you heard it, that you came because you heard it from us. But we'd recommend that you go to Manor House, excellent place. I've been there. I think Shirley's been there. I think Sharon's been there.
Sure.
So we can testify that it's a good place to go.
Okay.
Yes, it's a good place to go to. Right, I don't want to take up any more time. Is there anything else, Shirley, that I've missed?
No.
We're going to jump straight into it. So I would like to welcome our speaker for today, Dr. Travis Tramel, all the way from Georgia?
California.
California, sorry. Are you in Georgia at the moment?
Yes, I'm in Georgia at the moment. Yes, visiting my father.
All right. Now, I know that you've done extensive studies. I know that you've been to Oakwood College and you was looking at going a medical route in terms of not through your mouth, but like a doctor, I presume, but you kind of diverted, which is very interesting, because I would say that there's many professions that people would choose, but a lot of people, they see the dentist as being an enemy. You know, it's like like a tax collector. they don't like, people don't like people like that, not because they don't like the person, it's just because of what they do. And it's kind of, I see dentistry like that. For me, when I think of dentistry, I kind of have like a cold sweat, because it's just one of those professions. But I'm hoping that after this presentation, I will see things differently.
Yes.
So with no further ado, I'd like you to do your presentation. But just before, if you could just give us a little introduction of you and what you stand for, that'd be fantastic. And thank you very much before you start.
Absolutely. Yes, my name is Dr. Travis Tramel, and a little bit about me. I'm actually in Georgia because I'm from Georgia. Went through, matriculated from Georgia to Alabama, did Oakwood College when I graduated, then Oakwood College, University now. And from there, like you said, you're trying to think, what do I want to do? My degree was in biology, and most of us was geared toward going to medical school. And after that, what were we going to do after that? Most of them going to medical school. I didn't want to go to medical school because I knew I like my sleep. And when they talked about the rotations running 24 hours, and you got a pager and you got to get up when they say get up, or there's an emergency going on, I knew I didn't want that to be a part of my lifestyle. And so as we were going through, I said, hey, let's just do dentistry. Didn't have an option, didn't know, because even growing up, what do? You go to the dentist when something's hurting, right? It was not taught to be preventable. And once I got into dental hygiene school, actually, everything began to evolve. And thank God, I know I don't look it, but this is my 22nd year in dentistry. And this is actually getting into my presentation just a little bit. But I've had a blast. And it's been amazing. It's been an amazing ride. And then after that, 15 years, I began to get a little bored. And, you're doing the same thing over and over again. You can think going to the same building, seeing the same patients, and, it's exciting, right? But then my personality, as we get through this presentation, you're going to see that I love what I do. And a friend of mine, she's like, hey, let's make a change. Let's make a difference. And therefore we did. And so in serving the underserved and going into school districts, you began to wonder, where our education system, we don't see a lot of people who look like us in the school system. So how do our boys and our girls begin to, let's say, be mentored by like-minded? And so I decided to go back to school, and I got a PhD in Christian clinical counseling. And with doing that, I found out using that degree in the school system allowed me to get closer to kids and understand their backgrounds, where they came from, and how we can actually lift them up. And I don't know if the schools are different between the US and the UK, and how kids are raised, and who they see in front of their classrooms, and can they see themselves in those roles. And so I then took dentistry and made it a ministry. And through the ministry here, we're going to see, as I get through the presentation, what we've been doing. So that's a little bit about me.
That's very good. Excellent. The floor is yours. Let's go.
All right. Just do that. All right. Can everybody see the screens?
Yes, looks good to me.
All right.
I can see.
Beautiful. All right, here we go. Your mouth, is it in good hands? And how did I get this one? I don't know if you're familiar with the Allstate commercial. Is your insurance, is your car, is it in good hands with Allstate? But you can see here, you've been entrusted with your mouth. Is it in good hands? As we get through this presentation, you're going to see, is your mouth in good hands, or do you need some assistance? And that's who we are. And I know Brother Edgar said, hey, we're not the favorite people to be visited, right? And so therefore, we try to make it as nice and as comfortable and as smooth as possible. Because since we're not the most likable people, we try to love on you either way. Because when I show you what I'm about to show you, you're going to be running. You're going to be running to get it taken care of. You're no longer going to allow it sit and to fester and to bacterialize, because we're going to see that your mouth is the entrance into your body, correct? So what you put in is what you're going to get out. Now, I went into the presentation a little bit. My next slide says my story. Like I said, this is my 22nd year in dentistry. In 2015, I decided to change up a little bit, come out of the traditional dental sense, the brick and mortar, and we went mobile. And so I took my whole team and they said I was crazy. Let me do this real quick here. There we go, got it. To make sure that my whole team was gonna go mobile. They didn't understand the vision. I didn't even understand the vision, but I understood that when you're called to do something different, you have to step out on faith and do it. And that's when I didn't have a clear picture of where this thing was going to go, because my company name is Jerry Smiles, Jerry Smiles Mobile Dental Hygiene Practice. So when I came out of school, we learned how to be mobile, into mobile dentistry. It allowed me to see the world at a different speed. Why? Because through the dental office, you see the regular business as usual. The workers, they're coming in, they're going out, they're rushing, they don't have time for education. Come in, clean my teeth, fix my problem, let me go, let me pay, and I'm done. And it wasn't a ministry to me anymore. It was a job. And to most of you, when you're passionate about something, you will do it whether you get paid or not, right? If you will do your job without getting paid or not, it becomes passion, it becomes heart. It's what drives me, it's what wakes me up. And so Jerry Smiles, I started out in the geriatric population. I love them to death. A lot of them were on hospice. A lot of them were in assisted living facilities. And I was able to be that confident for them. Why? Because most times their family members don't come to visit them. So they utilize that time as a time to connect and to see somebody different, to share their stories and share their pictures. That was good. But I wanted more out of life and I wanted to do more. And so a friend of mine called me and she says, hey, I got to school and we have 100 kids. And I vowed I would not see kids because in private practice, I was stuck with the kids from 8 to 12. And usually those were the kids who were always with mom and dad, and the parent would come in, babysitting the kid, and the parent would want to sit on the dental chair, and then the kid sits on top of them, and then they're babying the kid, so you can't do your job effectively, right? And so at that point, I said, I'm not doing any more kids. But this one particular day, she called me and she says, hey, tomorrow, I have 100 kids. I can't see them by myself. Will you bring your team and assist me? And I reluctantly said yes. Hey, she's in a bind. What can it hurt? You know, as long as I can pay my staff, we're doing good. We have the day open. Let's go do it. And kid you not, that day, we saw those 100 kids and immediately a light bulb went off. These kids didn't act the same way as the kids did in the dental office. I found out when the kids are with their friends, their peer groups, they act totally different. And I was like, wait a minute, these kids aren't crying. Well, at that point, they weren't crying, and they were happy, and they were ready to get their free gifts, their toothbrush kits and everything. And they were in their safe zone. And that's what we learned. The school is the safe zone for these kids. Why? Because we don't know what goes home behind the closed doors once they go home. Hence, I was able to start sharing and caring and mentoring. And that started my journey into my PhD into clinical counseling. Because you don't know someone else's story. All you see is the cover to the book. You have to sit down, open up the book to actually hear their story. And when you look like them, they don't mind sharing with you when they know that you care, right? They don't care what you know. until they know how much you care, right? So that's my story, and that's what I'm sticking with. But now, let's move into this presentation. Why must I have my 2 front teeth? Yes, yes, everybody, why must you have your 2 front teeth? You know that's the basis of your personality. You know that is the basis of your job. That is the basis of how you eat. Because if I ran a customer service business and all of my sales force, everybody came in looking like this, how much product do you think we would sell? If they came to you talking like this and every word they said and saliva was coming out of their front teeth or the front hole, right? You wouldn't have too much business. Why? Because if you can't, let's see what the word I want to say, invest in your smile, in your self-care, in your self-awareness, who else is going to take you serious, right? Oh, it's about to get deep. How missing teeth can cause speech problems. Most people replace missing teeth to improve their appearance when smiling or talking. Even though these are good reasons to replace missing teeth, another reason is to make sure the speech is not affected. And we're going to learn how your speech is affected. Why? Anybody who's ever lost any teeth, front teeth specifically, family members, you've heard how they talk. Can't pronounce words correctly. Sometimes can't eat their food correctly. Try to eat a banana, to eat it to the side. You have to make alterations when things go wrong, right? You have 2 legs, you have 2 arms, 2 hands, you have 1 brain, but it has 2 lobes. You have 2 lips, because if you only had 1 lip, it would be hard for you to talk. 2 cheeks, everything in your body is in symmetry. So when those things are affected, you know, hey, speaking requires coordination between a person's muscles, the oral structures, the lips, the tongue, the teeth, your vocal cords, and your cheeks. Even though some of these oral structures play a more important role than others, hey, they all work together to produce speech, right? You got 2 legs. You got 2 legs for a reason, not just 1. But when one of those oral structures does not function properly, your speech may be affected. And you're going to have to change up how you talk. Or we're going to have to put back what was subtracted. And everybody knows how to do math, right? Always remember this. When you subtract, you must always add. When you subtract, you must always add. And we're going to talk about that as well. A way to understand how missing teeth affect speech is by looking at the development of children's teeth. Why? Because we didn't come into this world as adults, did we? No. We came in as babes, no teeth at all. Because if a child has already begun speaking and articulating words, the child's speech is affected when the baby teeth start to fall out and the permanent teeth have not erupted yet. Words that a child could pronounce properly when they had their baby teeth are now distorted because of the missing teeth. So, hey, here we go. We're going to do a little exercise here. We're going to speak a few words and you will notice how your mouth structure moves together to make the sounds needed for speech. Some sounds do not rely on the teeth, whereas others do, like TH. Everybody with me, TH says it pronounces a word is the. So you can see your top teeth, your bottom teeth, your tongue, the. So now your top teeth hit your bottom lip to give you the V sound, victory. Now I bit my bottom lip, frank. Supposing you didn't have your bottom lip. How do you say frank? Snake. Now you missing those 2 front teeth, and if you're just blowing air through those teeth now. Even for the Z, sounds, right? Sounds, or Z, zebra. So Z, you can hear the rumbling of the epiglottis. Zzz, that's what you're hearing in the back. So now you're going to say, thank you. Thank you so very much for this without your upper lip and your lower teeth touching the lip, tongue, or each other. Try it. Yeah, pretty hard, huh? Yes. Thank you. Top teeth, front teeth, you. You can hear your epiglottis. You can hear it in the back. You, there. All of those help with the speech and sounds. And guess what? Those are the muscles, the tongue, the cheeks that all must work together. But guess what? You didn't start speaking those words immediately. You had to be trained. So you can see oral health is very critical to your general health and well-being. Good oral health enables us to eat properly. And you're going to hear me say this many times. Eat properly, work productively. Anybody ever had a toothache? How well did your work performance? How well did you do your work? Did your work performance go up or did it go down? How well did your kid want to go to school? Mommy, my toothache. They're not ready for school. And if your tooth is aching, can you focus on a meeting? Can you focus on learning? Can you focus on your spouse or your significant other? What about you missing your front teeth? Or you're gonna go around saying, hey, how you doing today? And you're missing half your teeth. No, you're gonna be saying, hey, how you doing? Hey girl, how are you? Hey, I'm good, yeah. Why is she always talking with her hands over her mouth? Because you don't feel good about your appearance and you're not enjoying life. So guess what? If you was trying to eat your food, let's say our vegetables, and they were raw, or whatever you did, your carrot, your celery, vice versa, and you missing your front teeth, or an apple, and you trying to bite it, right? Nah, you got to alternate now. You can't just bite into an apple anymore, right? Because you're missing those front teeth. So now you got to change your lifestyle. You got to chop up everything. So you can see your oral health is very important to everything else you do. Now we go into the English IPA. Remember those words that we were trying to pronounce? Now look across the top, depending on if you're on a mobile device or your computer, or you get it on the big screen. You're going to see how you formulate your words like spy, starting from your left to your right. And you're seeing that all of the bilabial, that means the two lips, spy. I need both lips and my teeth and my tongue to say spy, baby, man. Supposing that we had a cleft lip, when we were born with a cleft lip, cleft palate, when it didn't form correctly. So therefore, you don't have the tightness that you need in order to make those words. Would, fall. As you move through there, take a screenshot, look at these words, and now you can help people now with their kids. Okay? Cat, go. So you see over there in the KGN, the go, you're getting way back getting all the way back to happy. Uh-oh. You can hear it back to the epiglottis, the glottal area, they call it. Uh-oh. That's the vibrations. Okay. So if you had a trach tube, you wouldn't be hearing those things anymore. So you can see different diseases and ailments can actually hinder your speech. The post-alveolar bone, red. If you had that cleft palate up there, you have a hole there. So you wouldn't be able to get that vibration. All right, let's move forward. So you can see the gateway to the rest of your body, right? Hey, go pierce your tongue. You know how they take the tongue and they split it in half, and you've seen the people with the tongue that looks like a snake? If they're talking like this, they're talking like they're got a tongue ring. Now your speech has been hindered, right? So everything that you do to your body, you actually mess up the system. So you've heard people with tongue rings. You've had people who've gotten tongue rings have gotten affected because they feel it's a tongue ring. I brush my teeth, but not realizing the foods that you eat have high in sugar. Basically, sugar forms a bacteria, which makes it acid, which then puts acid around the ball of that ring or that piercing. And now that bacteria runs straight into the tongue, which goes straight into the body, which then affects the heart. So when you see the gateway, it's the rest of the body. It provides clues about your overall health. It is sometimes the first place where we see signs and symptoms of other serious diseases, such as diabetes, heart disease. Sometimes I can see pregnancy, because if I've been seeing a patient for a while and I know their gums are nice and healthy and they did not bleed, then guess what? There's something going on that's causing an inflammation response. So what's going on? Women, is your cycle on? Why? Because your hormones are off. First place we will see is your gums. And we notice that by flossing. So those are things that I'm going to see. Also with diabetics or high blood or heart disease, I'm going to see dryness of the gums. And I'm going to see it's looking like little stippled, rubbery looks. Very dry, thick tongue. That means you are lacking or dehydrated. A lot of things could be going on. But unfortunately, oral health is too often viewed as extra service. People and insurance coverage typically focus on other health issues. Oh, my back is hurt. Oh, I gotta go find out what's wrong. Oh, my kidneys. Oh, it must be my pancreas. Oh, it's my sciatic, or is this? Other things take more presence than your own mouth. But after we finish today, I hope we turn this around for you. So the public health implications of poor oral health are vast. I'm telling you, your mouth here, there could be a slew of things going on. But you're going to realize that poor oral health impacts a person's ability to eat. Remember these things: speak, work, communicate, and learn. Now, are you going to say, kiss me tonight? Or are you going to say, good morning, good afternoon, good evening, welcome to blank, blank, blank. How may I serve you today? And what are you going to say? You need to serve yourself first, because this did not happen overnight. So we have to understand, we have to start looking at the mouth differently. How do you wake up in the morning with bad breath? Didn't you brush your teeth the night before? Did you floss your teeth the night before? Did you eat in your sleep? Did you drink something sugary in your sleep? So where did the bad breath come from? Bacteria. Bacteria, acid reflux, diabetes. A lot of implications coming through. So as we know, when oral diseases are conditions that are preventable, this is all preventable. If we understand, what does preventable mean? Preventable means doing the proper processes to actually make sure I cut it off at the beginning before it gets to the end. Because we want to be reactive people. Why do we have to do knee-jerk reactions? When all we had to do is simply brush, floss, eat healthy, exercise, drink water, not with our meals, but at least an hour before our meals or 2 hours after the meal you drink. Don't eat and drink together. Exercise, get outside, get our sunlight, get our vitamin D3, so we can actually help replenish our cells in our body, get our oxygen. Because when we got oxygen in our systems, our red blood cells begin to flow better. By getting good oxygen, we begin to think clearer. So you can see how all of these things relate to the mouth and how our teeth relate to the rest of our body. Look at my baby here. It's not my baby, but I called all the kids. Hey, because we as adults, we have to be about our Father's business. Our Father's business says, hey, everybody is a neighbor of ours. So here are the kids that I see in the school system. Now look at her. She's got her first molars in the back. They're already broken. That is, we love raisins. Raisins are good, but raisins are also high in sugar. High in sugar means, and they're sticky. So we stay away from raisins? Not really, but we can also brush our teeth right afterwards. And then anything that is sticky, crunchy, and it sticks in our teeth and we don't get it out right away, basically is creating you can see there, what we call is cusp. That's the high end points of the teeth. And then we have all of the little striations in the teeth there, the fissure lines there. And so what we want to do is make sure that even for little kids, we seal those first molars. Why? We put sealants on those, not fillings, sealants to actually cover those grooves up. Because those grooves are where we actually introduce bacteria or sugar into the tooth. When the kid doesn't brush their teeth, that sugar now seeps into those grooves. You can't get it out. And once this is there and stuck, basically it's creating the acid it needs in order to start forming decay. Hence, we brush after we eat. Hence, we floss after we eat. And my true saying is, you only floss the ones you want to keep. Only floss the ones you want to keep, right? Why? Because usually when a person smiles, you eat carrots. You don't normally see carrots on the front of the teeth, do you? Nope. You don't normally see food in the front of the teeth or on the teeth surface. You normally get it trapped where? Between the teeth. And if we don't floss the ones we want to keep, what does your food do in your refrigerator after 48, 72 hours? Do you eat food that's 3 days old? I don't think so. So when we don't floss, food gets trapped between our teeth and our gums. Guess what happens after 24 hours, 48 hours? It begins to bacterialize. And when you have bacteria, what is that? In the mouth is bacteria. In the refrigerator, what do we call it? We call it mold, right? That lasagna, you're the perfect cook. That lasagna was good the day you cooked it. It was even good the second day you cooked it. But come day 3, day 4, remember, the refrigerator is at 40 degrees. I'm in Celsius. Wait, yeah, Fahrenheit, whatever it is. Fahrenheit, my side, you're in Celsius. So mine is going to be different. So at 40 degrees, which is cold for a refrigerator, your body temperature is at 98. So that means you're going to bacterialize twice as fast as the refrigerator. So when food is stuck between your tooth and your gums, that is bacteria that you're smelling in the morning. So my suggestions, floss the ones you want to keep, and you can floss every meal or at least before going to bed. Here's another kid, baby bottle tooth decay, right? When you got to go, babies go to bed with the bottle. Oh, eat, sleep, or they're breastfed, vice versa. What are you doing with the kid? You're gonna let them sleep. Wrong. You're going to rinse that mouth out with water. Come off, let them get some water, rinse the mouth out. Or you're going to get a 2x2 gauze or a little rag or some cloth, and you're going to wipe that kid's teeth, gums, if they don't have teeth yet, the gums, and the tongue and the cheeks. Why? Milk, especially coming from the mom, remember that milk is only a replica of everything that you've eaten. Everything that you've eaten, that's how you produce the milk. Or if you're giving them bottled milk, Infamil or wherever they are, they have sugar in them. That sugar is what's causing the bacteria in the body. Why? Because a kid who's coming out doesn't have any teeth yet. It doesn't matter because they only have gums. But guess what's underneath those gums? We have tooth buds. Those tooth buds are forming when the baby comes out. Those tooth buds is what's going to develop into an actual tooth. But guess what? Your gums are very permeable, meaning your liquid can actually basically permeate through the gum tissue to those tooth buds and attack them. That's why you see kids come out and their teeth are brown, they're stained, or if you had them on high antibiotics, tetracycline or something because of an infection they had as an infant, then you're going to see what we call tetracycline stain. But for most of them, it's going to be baby bottle tooth decay, or you get the decay where it came from the bottle feeding, or like it was just breastfeeding, and that mother high in sugar. So it's always good. I talk to maternal health all the time, because the thing is, what you're feeding your baby is setting them up. Those first 5 years of life, you're setting your kid up for what they are to become when they become adults. So when we have tooth problems as adults, it started when you was a kid. And moms, I don't see it with dads as often, but I see moms, because you want to feed the kid from your plate. It's a good time to segue into this one. When you're feeding a kid off your plate, stop. Give the kid their own plate or their own bowl. Let the food sit there and cool off before you give it to the kid. No longer, after this presentation, all my new parents or the parents that know new parents, no longer do you take that spoon, that small spoon, put it in your mouth of food, cool it off, make sure you test it, and now give it to that kid. Guess what you just did? You just gave that kid, who what we call is a virgin mouth, no adult bacteria. You just now gave them the bacteria from your mouth, your spouse's mouth, wherever your mouth has been, you just now gave that bacteria to that baby. Am I making sense? After today's presentation, you're no longer going to taste the food for the baby, feel the food for the baby in your mouth, and give it to that infant or that kid. No longer are you going to drink from a cup and then give that cup to that kid. No, you should not kiss your kid on the lips if all possible. I've seen it. And just slobber, slobber, slobber. No. Adult bacteria does not belong in a kid's mouth. You just set your kid up for the disease of the process that's going on in your mouth. That's why I said this is going to be a deep conversation, because we've been fed all of this all of our lives. All of us are culprits of it. But we have to make a change, because we about to get deep. Let's move on. In the United States, the two most common oral diseases are dental caries, tooth decay, and periodontal gum disease. Risk factors for oral disease include unhealthy diet, particularly one that's high in sugar, tobacco use, alcohol use, and poor oral hygiene. Oh, I'm tired. I don't feel like brushing my teeth tonight. I'm going to bed, right? Oh, I love you, baby. Bacteria being transferred, person to person, spouses, significant others, dating. Your mouth, is it in good hands? Oral disease can also impact every aspect of life, as we said before, from relationships to self-confidence, through to school, work, the ability to interact with others. It can also result in social isolation and reduced income. Why? Because you got the brains. You had the job until you opened your mouth. And I had you for a high position. But because of your self-awareness that you didn't think it was more important to fix your teeth and you want a high-paying job, I have to pass you over. Why? Because you're going to represent me and you're going to represent my company. And I can't have you going out getting contracts because the package is nice, he or she, whatever, you well put together until you present. Yeah, you're talking about kissing your husband or your wife. Okay, so we want to go there. That's in my presentation, so it's going to come back up again. No, you don't kiss pets because pets lick themselves. Right? Front, back, smelling on the ground, lick, 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 and then you come and kiss them, and then they rub you in your face. Bacteria. Bacteria. So wherever that mouth been, you've been there twice. And this is the presentation I also give to which is a different presentation I give to my high schoolers and my middle schoolers. Because old Casanova, I said, who's the luckiest couples, or not couples, who's the most outgoing guy, the most outgoing female? Bring him up front. All right, I bring him up front. Oh yeah, he looks well put together. Who wants to date him? Oh, he's nice. Oh, he looks great. I said, now brothers or guys, whoever, who likes to date her? Oh, she's well put together. Oh, she's too smart. Oh, she thinks she's too pretty. Ah, cool. But guess what? They were together last week. One nighter. Then she left him because somebody from the football team, I said, oh, she's pretty. Hey, come on over here. You can be with me at the football games. She leaves him, she goes there. Boom, bacteria just reunited again. That's why periodontal disease, as we're getting into this presentation, is difficult to trace. Just like we're dealing with COVID tracing now, because what's going on is you don't know where it's been and where it's been up, down, all around, and what we're doing, right? Because she was with him last week, she was with him this week, now you're there. So whatever happened the 3 weeks prior to, you just attributed to a new bacteria strain. Oh, because she loves me. But I always say, as we're getting closer, your self-confidence, your self-awareness, social isolation, oral health is essential in maintaining general health and well-being. So it refers to the health of the teeth. Remember the teeth, the gums, the entire facial system that allows us to smile, all right? You don't want to smile, you're missing teeth. Speak, chew, and we talked about your cavities, your tooth decay, your periodontal disease, and oral cancer. Let's move. Brushing. You're going to brush after meals to help remove the food debris and the plaque that's been trapped between your teeth and your gums. Don't forget, you got to brush your tongue. Bacteria loves to hide in your tongue, because if you take your tongue when your hands are clean, you take your tongue, you open up your tongue, and you can see fissure lines in your tongue. Some people grow hair on their tongue. Yeah. Yep. Bacteria. So you got to make sure you brushing your tongue daily. Don't go so far back that you gag yourself. Don't forget your cheeks. You got that too. And if you really want to, I'm going to have you in a minute to actually take your finger, but your fingers is clean, the fingernail, and I want you to scrape your tooth from the gum line down and see if you see anything that's radiolucent on your tongue, on your fingernail. Okay, so here we go. We're gonna watch a quick video on how to brush your teeth.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
All right, so you brushing your teeth. They say change it every 3 to 4 months. I'm usually sooner than that. But if you're ever sick, as soon as that illness is over, trash that toothbrush, because the bacteria is still on there from the sickness and you don't want to re-infect yourself again. All right. Yes, you can also brush your teeth for 3 minutes. Hey, the longer the better, it's all good. 2 minutes is your minimum. 2 minutes, that's what she says, for at least 2 minutes on the top, 2 minutes for the bottom. Then if somebody said, well, I don't have that many teeth. Well, you still brush them at least 2 minutes, because guarantee you missed something in there. And you can never brush. Now, yes, you can brush the wrong. And she said a soft toothbrush. Yes, I have an electric one as well. And you want to make sure that we only use a hard brush when you haven't been brushing for a week. Got it? You only use a hard bristle brush when you haven't brushed in a week. And that should be never. Because if you waited a whole week to brush your teeth, you got a whole bunch of bacteria that's going on in there. All right. So when we flossing, you're gonna at least floss once a day to help remove the food particles and plaque that's between the teeth and the gums and along the gum lines where your toothbrush cannot reach. And we're gonna show you how to do that properly now.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about an inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
All right, so we talked about that one. So is the electric toothbrush supposed to be better than a manual? It just depends on. I have good dexterity, so I can brush just as good as an electric toothbrush can. If I get lazy, I'll use the electric one. But it does do its job. Now, if you got crowns, bridge work, that's when your electric toothbrush becomes better because you got different tips and different angles that you can get that electric toothbrush under the gums and between those bridges and those crowns to make sure you get that gum area. You want to stimulate that gum tissue because if you are let me show you this one. We want to be a wrist brusher, not a bicep brusher. Brushing hard to where your bristles start looking all frayed. So you want to make sure, and I knew that question was going to come up. We want to make sure that we brush effectively and efficiently, not just getting in there saying, I did it and I'm gone. No, you got to be systematic. What you're seeing, she says, upwards of 45 degrees up toward the gums when you're brushing. And then you're making sure you're going round and round and around. And you're making sure you get those angles because your teeth are not flat. They're curved. They have a curved angle to them. So therefore, when you're brushing, your brushing goes this way. So you miss the angles of those. And that's where your flossing comes from. And your flossing helps to get those areas to get where your toothbrush could not get. Now, when you get to an electric toothbrush that has a round, small bristled head on it, you can move it up and down and around those angles, which helps you also with your flossing as well. So I know it's gonna get what toothbrush is better. What toothpaste is better. And man, y'all tearing my presentation up because I told you at the beginning, I'm public health. So on public health, there's guidelines I go by and what we do as well, because I'm always in the community. And I give the kids what's available. I'm not going to give them a herbal toothpaste that's running $6, $7, or that's in US dollars, $6, $7 for a tube when they can barely feed their family. I thought fluoride was harmful. You're not drinking the fluoride, you're not eating the fluoride, right? Right? So what I like to do is you got your toothpaste, you brush your teeth, rinse it out, boom, you spit. You didn't swallow it. And even if you did have some, okay, it's not going to hurt you. It's not toxic levels. All right. So we want to get into that one. Is it safe or harmful? All chemicals are chemicals to me. It's a chemical, And also we talk about, which toothpaste is better. I'm going to tell you this. If you want to put it in the chat, I use Uncle Harry's. Uncle is here in the States, is in Washington as a mom and pop company. And they do all natural oil and healthy toothpaste made from oils. and your Himalayan salts and different things like this. UncleHarrys.com, a beautiful product line as well. And do you drink water after brushing? I don't drink water, but we can swish with it. I mean, if you want to dilute it, you can. That's fine there. And what, oh, sorry, I went to my next one there. I was just going to try to look at some of these here. What does drinking and eating cause to our oral health, since we aren't supposed to drink and eat? What does drinking and eating cause? Basically, when you eat and drink together, what it causes fermentation in the gut. Because of your food, your digestive system, it needs to digest the liquids before it can actually start working on the actual food that you've put in there, and which may take a couple of hours. So if a couple of hours your food is sitting in water, it's just like you're going into a swamp. Swamp is not where you want to really hang out at. And so what you're doing is causing belching, indigestion, sometimes gas. When your food is sitting there for so long and you've drank a big 32-ounce juice on top of your food, and your body got to rid the liquid first. By the time it gets to the food could be fermented a little bit. So you can flush away the fluoride from the toothpaste. Sure, it's not that, and the toothpaste is not, I mean, you're talking about 1 part per million, very small amount. Why does breath smell worse after brushing teeth? That's another whole ball game there, because your breath should not smell worse after brushing your teeth. Try with a mouth rinse. Try brushing your gums or your cheeks. You still have some bacteria on your cheeks, or it actually could be coming from your gut. Your GI tract could be off. Might want to start with a probiotic or something like that, but those are some things that we have to look at. Yeah. Hold on with those questions, man. Y'all getting deep on me. How soon after eating would you recommend brushing? I was told 30 minutes. If your food doesn't have a lot of acidity in there, you can brush it right away. Just go ahead and brush it. 30 minutes is not going to make a big of a difference. I mean, if you have sugar on there, you can wait 30 minutes. There's not a rhyme or reason how long it should be. Even if you don't even brush, I would just recommend just flossing to get that food from between the teeth and the gums there. Okay, so they give me a time crunch here. Let's get into this plaque. Now, dental plaque, that's what I wanted you to do with your fingernail, is to pull that tooth, your fingernail down your tooth. That dental plaque is sticky, colorless, pale yellow film that is constantly forming on your teeth. When saliva, food, fluids combine, plaque, which contains bacteria, forms between your tooth and your gum. Now, of course, you can see the plaque that's on this guy's teeth here. All of this here. This plaque is actually turned into what we call is calculus, because the plaque is this colorless film here. It's cottony. It's what it looks like between the tooth and the gum. This is all the bacteria. You can see where the gums begin to turn red. And that's the first sign of disease. Now, this is where everybody is going to talk to me. You don't have to talk to me physically, but you're going to talk to me in the chat and say, hey, how many of you have ever brushed and flossed and your gums have bled? Give it to me in the chat. How many of you have ever brushed or flossed and your gums have bled? Don't be shy now. There you go. We got one. Okay, good. At least we got some honest folk in here. Good. Matter of fact, give them that prize. Give them that prize for answering the question. Now, did any one of you ever raise your hand after you brushed and flossed and your gums bled and you saw it in the sink? Raise your hand and say, hi, my name is X. I have a disease. Nobody ever did that, did they? Why? Because dental plaque is the first sign of disease. The second sign is the mildest form of periodontal disease. What's that last word? Disease. It causes the gums to become red, swollen, and they do what? Bleed easily. There is usually little or no discomfort at this stage. Gingivitis is caused by inadequate oral hygiene. Gingivitis is reversible with professional treatment and good oral home care. Right. So flossing. When I see the blood, Let's say, for instance, here I am. I'm in the shower. I'm taking a shower. Woo, 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 woo. And all of a sudden, my bicep, boom, it starts bleeding. And it's bleeding uncontrollably. What are you going to go do? Put a bandage on it. Take the bandage off. It's still squirting out blood. Guess what we're going to do? We're going to see the doc. Hey, doc, what's going on with my arm? I can't stop it. Can you suture this up? Something's going on. We easily run to our physicians. But not one time did you say, ooh, I have a disease. I'm going to see my dentist. Nope, we don't do that. But you can see gingivitis, it came from the plaque. Excuse me. It came from the plaque because the plaque was the simplest form. Brush your teeth, brush those gum lines, angle that toothbrush up, floss. And all of a sudden, I flossed it long enough, it could have been a popcorn kernel that was stuck underneath the gum that caused the bleeding. I had a patient tell me she hadn't had popcorn in over 6 months. But when she came and got her teeth cleaned and I pulled out the popcorn kernel, she was like, oh my goodness, if that's why my gums were bleeding? Yeah. This is why. This is why. Dental tartar, we got to move. After the dental plaque, remember the plaque? Plaque moves to gingivitis. Gingivitis moves to tartar. After 48 to 72 hours, that plaque, if it's not removed, it turns hard. Why? Because your mouth is closed at night when you're sleeping. Unless you're a mouth breather, then it's twice as fast. Because what's end up happening is that you're breathing, it dries the mouth. So that plaque that's stuck there, then it begins to harden. That's the dental calculus. It's a crusty deposit that can trap stains, especially if we're using a lot of curries and different things like that. Green, yellow, whatever the colors, whatever the foods that you're eating, if it has some type of a food coloring to it, it will stain that plaque and discolors your teeth. It creates a strong bond that can only be removed by a dental professional. And that's when we got to pull out that to clean your teeth. And that's what we usually call it a deep cleaning or periodontal cleaning, things like that. And we want to make sure that tartar formation may also make it more difficult to remove the new plaque and the back. So if you try to floss it, guess you get floss in there and all of a sudden the floss starts breaking. It could be because you have some tartar underneath your gums. And every time it hits it, it's going to break it. Okay. So now untreated gingivitis, plaque goes to gingivitis, gingivitis goes to that hard tartar now moves you to periodontitis, whereas untreated gingivitis can advance to periodontitis. And that's when now that bacteria is under the gums and it's actually eating bone. It's an acid, it's eating the bone and it's eating your gum tissue away from their tooth. That's when a person's tooth starts looking like it's longer. Because now that gum line that used to be down, covering that root, now we got root exposure. Those toxins produced by the bacteria in the plaque, they begin to irritate the gums and the gums say, I'm backing off, right? So that's what we can do. So now make sure you see your dental providers regularly, at least every 6 months. But if you've been categorized as periodontal, it's every 3 months. So what happens during periodontal disease? We talked about number one, the tooth is all nice and healthy. The gum tissue's nice, firm, nice and pink. The tooth is looking nice and set in the gum tissue. The bone is healthy. It's all looking good. And then we move into gingivitis. The gums begin to inflame. It may bleed a little bit. We got a little plaque buildup around there. The gums are already bleeding. They're saying, help, something's going on. Help me. Floss. Drink more water. Flush it out. I didn't hear you. Then it moves into periodontitis stage. Pockets form under the gums. You've heard of those pockets when the hygienist is calling 2, 3, 4, 5, 6, 7, 8. When they're measuring, we're going to talk about that as well. When the pockets form, the gums starting to recede, bone starting to deteriorate. You can see there. And Lord knows we don't want to go into the advanced periodontitis because sometimes we got advanced bone loss and tissue damage and the deepening of the pockets, which sometimes a tooth might just fall out. We want to be careful there as well. So they're going to use a periodontal probe that talking about the enamel, talking about the gum tissue. We're talking about the periodontal ligaments that's holding the tooth to the bone in a socket. So you're seeing the bone here and you're seeing the gum tissue. So these periodontal ligaments, every time food gets trapped underneath the gums, it causes that irritation. That acid goes down, eats these ligaments, and the gums begin to fold away. So when you're hearing those numbers, we want to make sure 1 to 3, yay, healthy mouth, healthy mouth. 3 to 5, we're moving into that mild periodontitis stage, the early to mild. 3 to 5, 3 is still the healthy, but you're that 1 millimeter closer to periodontal stage. 5 to 7, we in moderate. We need a deep cleaning. We need some gum therapy. 7 to 10, advanced. We might need some bone grafting. But we got to get rid of the problem first. Get rid of the problem first. What is causing your gums to be inflamed? Is it the foods that you're eating? Is there some other intestinal problem that's going on? Or is it a heart problem? Inadequate blood supply going to meet those areas because your blood supply does supply your teeth and gums. They're nutrients. We talked about periodontitis. That's where the gums begin to separate from the tooth. And you can see from that picture, here, look how bulbous these gums are looking. If I touch it, if I even pick that plaque off, that gum just gonna say, it's just gonna start oozing with blood. Because that's that bacteria. It's trying to get out, get out, get out. But because, like somebody says, when my gums used to bleed, they don't bleed anymore. 1 or 2 things. You took care of the issue. Or number 3, this patient said the same thing. My gums don't bleed anymore. Because you packed the pocket with more plaque on top. So the bacteria sitting underneath there, it doesn't mean that it's going away. You just covered it up. And that's what's going on here. So as the disease begins to progress, the pockets deepen, the gum tissue in the bone is destroyed. Often this destructive process has very mild symptoms. Eventually the tooth do become loose and may have to be removed. Age comes with stress. Remember if I said, if you remove, if you subtract, you gotta add. Because if you notice in a tooth that you had extracted in the back between 2 other teeth, what happened to the other teeth, the one in the front and the back? Didn't it begin to change position? If you lost a tooth in the top and you still have one in the bottom that occludes with it, did the bottom tooth, then it starts erupting and coming out a little bit. So now it's touching my tongue, right? Or if I remove my top teeth and my bottoms and I didn't remove those or something didn't happen with those, then they begin to start uprooting. So that's why you have 2 sets of teeth, a top and a bottom, because they come together every time you chew. And if one is missing, this is coming up, it has nothing to occlude to keep it in the place, then it begins to start erupting outward. Or this becomes start coming down. So you see that the older we get, the higher our periodontal disease rate goes. 70% of Americans 65 years and older have periodontal disease. Why? Because the older they get, the less permanent teeth they have. They've exchanged their teeth for partials, dentures, and yes, they do need to be cleaned as well. But also the diet begins to change. Why? Because my teeth are soft and I can no longer chew hard things anymore. So now my diet goes to soft serve. Soft serve has what? High in sodium. High in sodium brings high in sugar because they're soft, but I need it to taste good. And because I don't have that crunch, now it doesn't keep my teeth nice and sharp. Smoking. The more we smoke, remember we inhale, we tighten up the lips. That means we constrict the blood vessels, plus all the chemicals from the nicotine and everything that's in the cigarette goes into the mouth. It also hinders the blood vessels, or it constricts the blood vessels, meaning the blood vessels in the mouth no longer constrict and contract anymore because of the heat and the chemicals. That nicotine also gets trapped underneath the gums, which now the gums look very tight and firm. Is not the healthy, tight and firm, because the nicotine is underneath the gums now. Now it actually hinders the gums because now the blood vessels aren't constricting and contracting. So now you don't get the proper nutrition to the teeth and the gums. So therefore, periodontal disease, it just exasperates. So basically, it just pushes forward, and all of a sudden, you get to a point, because they say if you're diabetic and if you smoke, guess what? You can't get implants. Okay. So we got to remember, things that we put into our bodies, it may not be affecting us now, but it's going to affect us later. And how do you prevent it from, that from happening when you're older? Prevention. Watch the foods that you eat. And we're going to do some more stuff here. I'm not done yet. We got to talk about genetics. Well, I'm going to lose my teeth because my mom and my grandmother, they lost their teeth too. How many times you've heard that? But guess what? God gave you your own body. He gave you your own teeth. You're not sharing teeth. You only share genes. Genes are turned on or they're turned off. Lifestyle, trigger, gun. You pull the trigger by your lifestyle. Right? So genetic means, I got that predisposition to have periodontal disease, but I don't have to, I don't have to bring it forth. I don't have to call it out. I don't even have to get it, because I'm going to the dentist every 3 to 4 to 5 to 6 months, whatever. I'm brushing my teeth. I'm flossing my teeth. I'm eating healthy, and healthy is a relative term as well, as you know, going through the different classes. So we got to make sure what we really call healthy as truly being healthy. Because you're going to see some other stuff I got coming for you. Stress. Heck, everybody is stressed right now because we don't know. We're looking at everybody's side eye like, hey, you got COVID. Oh, you've been around somebody. Oh, you did this. You did that. Why? We stressed. So not realizing that stress also messes with your mental health. So stress is linked to many serious conditions such as hypertension, cancer, and numerous other health problems. Stress is also a risk factor for periodontal disease. Why? Because when you're stressed, you clench, you grind your teeth, and putting that grind on your teeth also causes fracture lines in your teeth. And stress causes high blood pressure. So therefore, high blood pressure, that means your blood is not moving like it should, or is moving at a rate that's too fast. You're not getting enough oxygen, or it makes it hard for you to fight off infection, including periodontal disease. Can you save baby teeth as an adult? Sure. You sure can. But because your teeth have different shapes, that means you got to take even more control of your health. Drugs, medications, antidepressants, contraceptives, heart medications, they also affect your health. Ask your dentist, ask your provider, ask your pharmacist, what are the side effects according to my health? Or you take it because yourself. They may not even know. Nobody talks about oral health and its implications. Oh, you have a wonderful grandmother. If she was in her 60s, she had all her teeth. That means you got good genes, but do not take that for granted, because that was grandmother's mouth. Remember, grandmother ate from the ground. She ate from what they grew. She didn't eat from cans. They didn't open up cans. They ate root, healthy foods. We eat fast food. Well, no, I don't eat fast food. But now the culture now is we eat fast food. We don't have time to cook. Our lives are too busy, too fast. We don't take time to eat healthy. Eating between meals do affect the body as well, your teeth, because every time you eat, your body got to start working. Every time you chew, you're even put a piece of candy in your mouth. Between a meal, you restart your digestive system. Now, what if I work each one of you 24 hours a day, 7 days a week? How would your body feel? Worn out. But we don't think about our gut, our digestive system. When we eat at 8 o'clock, We got a snack at 10. Our lunch is at 12. A snack's at 2. So that means every time you eat, you restart your digestive system. Remember, digestion system takes 4 hours to complete digestion, a 5th hour to rest. And if you implement anything into your mouth, I don't care if it's peanuts, a piece of candy, a piece of chocolate, you stop the digestion of that food, go back now, it's got to come down, get what you're bringing in now, stop what it's working on, and now restart all over again. So we have to make sure that we're taking care of our bodies so we don't have to ingest medications. A poor nutrition and obesity. A diet low in important nutrients can also compromise the immune system and make it harder for the body to fight off infections. Because periodontal disease begins as an infection, remember that plaque? Those small little traces of blood? Poor nutrition can worsen the conditions of your gums, anything that's high in sugar. So you got to make sure that we are taking care of what we've been given. So now gum disease, as we're getting closer here, we're almost wrapping up here. Gum disease symptoms. Gum disease is often silent. It means that the symptoms may not appear until advanced stage of the disease. Okay? Because when your gums did bleed, they didn't scream, ah, pain. No. When you got that splinter in your finger, you felt that splinter, didn't you? And it hurt until you got it out. But we got to make sure that we are our teeth keepers. Your mouth, is it in good hands? Do not leave it up to your dentist every 6 months to make sure your mouth is in good hands. So I gave one of your challenges, and the challenge said, remember the meat and the sugar challenge. What type of teeth do you have? Do you have carnivore teeth? Do you have omnivore teeth? Do you have herbivore teeth? Do you have frugivore teeth? You have human teeth. Yeah, somebody says, I have fast foods for treats like birthdays. Once a year. You can only detox it once a year as well. It still has a detriment to your body. Is activated charcoal good for brushing? Sure, but charcoal is also abrasive. So we use things like that sparingly. So we remember the meat and sugar challenge. Why? Because the type of teeth you have depends on the type of food you have. As you can see this chart here, it talks about how well we open and what foods that we should be eating on. Because a person who has a high meat diet, you do a lot of chewing, a lot of pouncing on your teeth, a lot of pouncing on your gums. There's a lot of nitrates and nitrites and a lot of antibiotics and a lot of steroids that are in meats today that also affect your gum tissue, that also affects your teeth. It also affects your ligaments in your teeth. And if I told you every time how you chew your food, 20 to 30 chews per meat eating, then I tell you to stand up and I want you to jump up and down as many times it took you to chew your food for that meal. How would your ankles feel? Woo! That's right, wore out. But that's what we're doing to our mouth. And that's why I asked, your mouth, is it in good hands? Are we taking care of the mouth that feeds us? Or oil rinse is good for teeth. Sure, if you got the time. I've done it once. Did it work? I have no idea, but I did do a bacteria test and I found out that the bacteria was gone. So yes, it does work. And then we're going to talk about this. Dr. Milton Mills, hear him out for the next few minutes as we wrap up this session here.
I had so many questions I wanted to ask him, starting with why he thinks we are herbivores by design.
Look at the way human beings are actually constructed anatomically and if you look at our physiology, we are truly strict herbivores. And that's why when we depart from a strictly plant-based diet, we become ill. That's why diets that contain large amounts of animal food are associated with a number of chronic diseases like heart disease, cancer, diabetes, autoimmune diseases, high blood pressure, stroke. The more we eliminate animal foods from our diet, the healthier we are. And again, it has to do with the fact that we are really designed to eat a strictly plant-based diet.
Yeah. And I guess for the people that want to know how specifically we're designed anatomically to eat plants, you just have to look at our physiology, like the jaw structure, the stomach acidity, the length of our intestine, stuff like that.
There really is no advantage in human beings eating large amounts of protein. There is no point to consuming huge amounts of protein because it's not healthy for us. Number one, the human brain is mostly fatty tissue. It burns pure glucose, which comes from carbohydrate. Protein is not the preferred energy source for our brain. So eating huge amounts of protein is not helpful for us because our bodies can't store protein. And so any protein that we take in over and above what we use on a daily basis, which is approximately, say, 50 to 60 grams of protein on a given day, is converted into carbohydrate anyway. And that process of converting that protein into carbohydrate is very energetically costly. It dehydrates us, and therefore it doesn't pay for us to try to eat huge amounts of protein because it saps too much energy, uses up too much water, and doesn't get us any physiologic benefit. So again, it doesn't make sense that humans would have wasted a lot of energy looking for protein that doesn't help us.
Yeah, it's interesting, isn't it? Because from what you just said, it's made me realize like the reason plants are so colorful, for example, fruit and veg, is so bright to the human eye. It's because humans are natural herbivores. We're designed to eat these foods. I'm just wondering whether there's any other evidence like this that clearly shows we're natural herbivores.
If you think about plants, the edible plant parts are hand-sized objects that are smooth-edged, brightly colored, and they're small enough to be held in the hand, and of course they smell and taste like plants. So what do we do to animal tissue to make it acceptable to us? We take it, we skin it, we cut it into these smooth-edged objects. We then take the blood out of it, we cook it so that instead of being wet and slimy, it's now firm like plant tissues. But most importantly, we cover it with all of these plant products to try and make it taste like plants, which is what our brain really wants. So we really don't want the animal tissue, because if we did, we eat it the way the carnivores do. Wet, slimy, bloody, and rotting. No, we take it and try to make it look and taste and smell like plants in order to make it acceptable. Furthermore, the fact that we actually cover ourselves with the scents of plants to make ourselves more attractive tells us that plants have always been important throughout our existence as a species. And the reason we like to smell like plants is because that is a subtle signal to our brain that we have been ingesting the compounds that actually make us healthier, make us live longer, and make us more resistant to disease.
Wow. So you can see, we spread love, not disease. And the challenge was no meat, no sugar. If you see that within 1 week, weight changes, your mouth will change, your sometimes infected gums will change, your moods will change, it's just your overall being. You feel lighter. And that's why I always say, after you eat, we go do a 15 to 20 minute digestive walk. And guess what? You don't fall asleep after your meal, even if it's an unhealthy one. But if you're activating your pancreas and saying, hey, I got this, don't produce no more sugar, don't put me to sleep, I'm going to handle this, and I'm going to go walk. I'm going to use the sugar of the foods that we just ate, and it's actually going to help, and we're going to use that. So the foods that you eat It actually works on your body. Food is like a medicine. Is it going to help you or is it going to hurt you? And you just want to make sure that you do what you do best. Is your mouth in good hands? Thank you so much for the presentation time.
Thank you, thank you, thank you. Excellent presentation. I think even my view of dentists has been changed by that presentation. Maybe the dentist is not an enemy, but a friend.
It's a friend.
And we need to view the way we think differently. But thank you very much.
And that's why they call them family dentistry.
All right, all right, all right.
So your whole family can come and partake.
I hear you, I hear you. I know that you've been taking questions as we've been going along, and that's been very, very helpful. So we're gonna still do the question and answer. We're not gonna open it up for you to unmute and ask questions. So if you have a question, Shirley, Sharon, anybody else, if you can be ready, we will take questions through the chat, and Travis can answer them directly, or we'll help you in terms of if there's any questions you've missed.
Gotcha.
One caveat quickly, he's not here to do a consultation. I know people can get carried away. You know what? Like Jesus is here, I've got to get him while he's here. But we're not doing consultations. We're only doing general questions on general problems.
Gotcha.
I will ask one question though. If somebody wanted to have a consultation with you, would that be possible? If obviously your time permitting, would you be able to do something like that, or not really?
Sure.
Okay, so if you at some point, if you can show your details or let somebody know, you know, how they can contact you, then that can be like a saving grace sort of thing, because we're going to be batting people away. Don't want to no, we're not doing that. Not today. No. But if you can give them some information, then possibly somebody could contact you.
Yeah, they can WhatsApp me. WhatsApp.
Fantastic.
Okay, I got a quick question here. Somebody hit me directly with this one, which we had Sharon and I had already talked about, which is amalgam fillings. My thoughts on amalgam fillings are this. It is a metal. And anybody who's used to metals in vehicles and cars, what happens to metal over a period of time? After it's been weathered and torn, it rusts, right? Just like metals in the mouth or amalgam filling in the mouth. You chew on ice, you chew candy, you chew nuts, whatever, it changes form. Why? Because we chew ice, cold, we go get a soup, hot. So you got an expansion and a contraction. When is the last time your tooth expanded and contracted? So over a period of time, it begins to break down the tooth and cause fracture lines into the tooth. And that fracture line can be there. You don't see it, but through a light that we use on the tooth, we actually can see that fracture line and say, hey, I'm sorry, we need to remove this. You need to put a crown on it. So are they good to get? Some people have had them for years, and then they don't experience problems until they actually remove it. So I always say to remove them is a personal choice. But if a person is older in age, which the linkage is there now, we're dealing with Alzheimer's and dementia and other autoimmune diseases where you're seeing metal leakage, because it does leak over a period of time and it can get into your system. And if it gets into your blood system, where does the blood lead to? Heart and brain. So that was the amalgam question there. I said, do you have any advice on how to remove them? Like I said, there's certain dental offices that you'll have that'll have high-speed suctions and evacuations, and they use what we call rubber dams that just isolate that area. So as they're removing it, It doesn't, number one, you don't breathe because you're still breathing. I would say if you can get on oxygen or have them to put you on something that you're breathing clean air versus the regular room air, and that they have that tooth isolated with a rubber dam as they're removing the pieces of the amalgam, because as they're chipping it away, you can smell the aerosols, you can smell the fumes from the actual amalgam, and you don't want to ingest pieces of it, because if you breathe it, where does your breath go? I mean, you're breathing, it goes here into where? Your lungs. And those are things that you want to just keep away from as much as possible. All right, next, you got some questions for me. Go ahead. I forgot my number here.
Have you got anything, Shirley?
There was one. I'm not sure if Dr. Travis mentioned it earlier regarding coconut pulling. You know, the coconut. I'm not sure if you mentioned it, Dr. Travis, but I did see that pop up.
Yeah, I did mention it a little bit. Just remember with coconut oil, it is a oil. And if you're going to switch with it for 20 to 30 minutes, making sure it spits, do not go into the sink or into your toilet, put it right into the trash can. Because once you rinse your sink up with some cold water, what does it do to that oil? It binds it. And so therefore, now you got to call your plumber because your water's backed up. Now, have I seen it work? I've seen literature on it. I have only done it once, but I don't usually have like 20, 30 minutes to sit there and swish on oil. But I have heard that it does work. And like I said, I did it once, and then we went and did a saliva test, swab off the cheek, and I was clean. So it works.
Okay, thank you, Dr. Travis.
Yes.
I've gone to the top and trying to remember which one you've mentioned and which one you haven't mentioned during your presentation. I'm not sure if you mentioned this one. Someone says that they mix bicarbonate of soda and mix it with toothpaste and water. Did you cover that one in your?
No, I didn't, but it's fine.
Okay.
Because we have a mixed audience, and I always say, use what you have, right?
Okay.
Our grandparents, my great-grandmother, that's all they used was, which is called baking soda, bicarbonate soda, right? And we get into that ingestion portion, making sure we rinse it out, get it out as much as possible. It is natural as we can get it, but it is a chemical as well. And so you just want to make sure that you're using it sparingly if you're going to use it. But I try to use, like, if you go to if you look at UncleHarry's.com, they have beautiful toothpaste. You can use it with peppermint oil, spearmint oil, bentonite clay. Those are some of more your healthier options there. And that you can use for your presentation on Thursday when you're making your own toothpaste.
Yes, definitely.
I have a question. It says, how do you get rid of discoloring, your teeth discoloring?
Oh, man. Okay. You have options. And is there anything wrong with whitening, peroxide? I've used tooth whitenings. We used, what did I just tell you? Charcoal. Bentonite clay works as well. Bentonite clay with a little pink Himalayan salt. You can use those. If you want something quick, easy, I would say the fastest one would be the baking soda. But don't make it a idol because your teeth are white, they're fine. You can make them more porous doing that. And so you got to be careful when you're messing with your teeth, even though your teeth are the hardest thing in your body. But you just want to make sure you're not making them too porous, where now everything that you eat, drink, and it'll just stick to your teeth. So that's what you just want to be careful of.
Okay, thank you for that. I've got one more. It says, what is your position on implants, i.e. titanium?
Remember, I said, if you subtract, you must add. If you can afford the implant, go for the implant. If you can't, get your partial. God forbid you have to have them all removed. Then you go for all implants. But yes, I would always say put an implant in if you can, versus a bridge. And why do I say that? I say because a bridge, normally if there's one tooth affected, to do a bridge, you got to affect two healthy teeth, one in front of it and one behind it. You got to shave those down in order for a bridge to fit for that one tooth that you lost. So you just want to be careful there. So if you got a chance to do an implant, do the implant. Just affect the one tooth that you had extracted versus all of them.
Shirley, you've got something?
I'm trying to look. I do see one about root canal treatments.
Mm-hmm.
What about root canals? And then aluminium filling is it damaging to the brain? And I still got 11 more questions to even look through.
I'm good. I'm good with time. Root canals, yes. I would say save the tooth versus extracting the tooth, especially if the tooth is good. The root is, or the nerve is damaged, right? It's just how they prep that. And I can't get into the full treatment and all of that because everybody does it differently. But if you always say save versus extract as much as possible, because if you extract, you got to replace it. Okay, so save as much, repair as little, prevent always. And prevent by how much we're eating, how we're eating, how hard we're chewing. And if we're stressing, if we're grinding, if we're clenching, and they recommend a mouth guard, use it. Use it, because there's nothing like preventing stress fractures on your teeth, and you're affecting the whole mouth at that point in time. And is aluminum fillings damaging to the brain? I don't say it's damaging to the brain. I would say, because there's no science in damaging to the brain, because aluminum fillings are aluminum fillings. Remember, we pulled the trigger. We was chewing on the ice. We were chewing on the hard nuts, or vice versa. Hot, cold, and all of a sudden we changing our body chemistry up. And so if you get any leakage, who knows where the leakage goes? And those are the things that you want to be. I would say, if you can, I'm not diagnosing, I'm not treating, use your composite fillings as much as possible.
Okay, thank you for that. I've got another question. It says, is it true that there's a link with chronic tooth abscesses and health disease?
Absolutely. Your body got to fight, just like your gums were bleeding. Your body is fighting, trying to get rid of what the issue is. Your body knows when something external has infiltrated. And so what it's trying to do is get out wherever it can the bacteria that it's possessing. Sometimes, and we don't pay attention. How many of us look at our mouth and actually watch ourselves brush our teeth? No, usually our eyes are closed. We're humming a song. It's like we don't want to look in there where we're scared of what we're going to see. But the next thing is, okay, that's just like going and taking a shower and not looking at nothing. We just bathing. I don't want to see it. I know I got an abscess on my leg, but I don't even want to look at it anymore. No, we got to pay attention to our body, because your body speaks to us. And it speaks definitely in your mouth about other diseases that's going on. So now let's be attentive. Your mouth, is it actually in good hands? Because I always say God gave us a temple, and our job is to do what? Take care of that temple by all means necessary.
Edgar, you're on mute if you're talking. I don't know if you're speaking.
Okay, sorry. The question I've got here is, does oral sex affect your mouth health?
Absolutely. This is my middle school and high school education class here. Why? Because remember, partners, multiple partners, bacteria, and now we have to talk about anal. I don't know what our demographics on here, but we have to talk about it, because disease, Disease doesn't know name, it doesn't know color, it doesn't know race, it doesn't know ethnicity, it doesn't know male versus male, female, female. Because where you take bacteria from and where you put it next is just a transfer. And that's why I think today we are ramping up with diseases and more cancers now in the mouth. Because of the foods that we eat versus being washed or not washed. But more oral sex is more prevalent now today than it was prior to. And all you're doing is transferring from low areas of the body to the upper areas of the body. And guess what? From the mouth, it goes, you know, your mouth, a sinus, and your brain is right there. So that's how we're crossing the brain barrier now. So yes, disease that is not talked about, and whatever, you know, that's why God meant sex to be with 2 organs, not with 3 or 4 organs. Mouth, anus, male and female. And so we have to look at transferring those bacteria to different areas and how it affects the brain. If that makes sense, I kept it generic enough.
Yes, thank you very much. It does make sense. I have another one. It says, why is dental treatment very expensive?
Oh, I get that one too.
Good question, eh?
Yeah, go to Loma Linda. Shucks, it's $425,000 when you leave. Yeah. And then you want to live in California with a median house in the median housing price is almost what, $500,000. And plus you got to look at the equipment, and the pandemic really exposed this because 80% or maybe, yeah, 80% of dental material is all disposable. Only the instruments that we use is actually sterilized. Everything else is disposable. So therefore, that's an ongoing recurring cost. And what insurance do people mostly ditch first? Dental insurance. But I got my medical. Why? Because I'm going to see my physician. My mouth, oh, I can take care of that one. I'm in good hands, right? But yeah, dental, I mean, yeah, look at your deductibles for dental. They're 3 times as high as actual medical. And your insurance, and we usually get the cheapest insurance plan for dental. But guess what? When I tell people that, I says, well, if you only paying $15 a month and you got $1,000 worth of damage that's due, who's going to be upside down, you or your insurance company? So if you're paying $15 a month out of your check or every 2 weeks out of your check, guess what? When you get to the dental office, you're going to have to make up the difference. That's why they say your copay. Your part is this, because your insurance is only paying this. And that's why your insurance companies will cover, well, I can only speak of the states, amalgam fillings, free. Composite fillings usually start at $95. Why? Because they call that elective. Oh, that's what we call it. You know, they have the elective plans and then they got the regular. The regular is what your insurance gonna cover. Why? Because it's the least expensive, but it does last. Well, give me what my insurance cover. But is it the best for you? And that's what we got to start looking at with our health. Yes, it may cover it. Well, my insurance company knows better than me. No. All they know you is ID number 6254321. That's what they know you as, and you paid your deductible, or you paying your monthly premiums. So your insurance company, they can care less about your health. They don't know what's good and what's bad for you. So that's why these presentations are awesome, because you get to choose this day whom you're going to serve. Serve your insurance company or serve your body what it actually needs in order to stay healthy. Only you know you.
Got another question. It says, does Does root canals become a harbor for bacteria due to being a dead organ in your mouth? I think it says yes. Do you want to repeat that?
No, I understand.
Okay.
It doesn't produce more bacteria because it's a dead organ, because remember, they closed off the nerve. So the nerve is not being fed anymore, but the crown that is on the tooth is a foreign substance. Remember I said, your body knows, okay, let's say for instance, those who wear earrings, right? Females, males, everybody wears them now, right? Anybody who wears an earring, and you just can't wear any earring, because if it's a fake earring, or I found them for $5.99 or whatever, you got some good ones and you got some bad ones. I'm just gonna get some cheap ones. I put them on. What normally happens behind the ears of fake earrings? Anybody know? They call them keloids. All right, the big overgrowth on the ears, the earlobes, they get fatter because there's a lot of material body basically revolting against the fake metal. When you can't wear fake metal on your ear, and this is going to help somebody today, do not put fake metal in your mouth. Okay, I'm gonna say it again. Well, how do I know? You don't know. You will know from the first time you put an amalgam in your mouth, and all of a sudden you got an infection in your mouth now, because your body will resist it. And at that point, you got to go pay, remove it, put a composite in there. Or that's just like getting a crown. Well, I want a zirconium crown. Great. I want a Captech crown. Great. Oh no, give me what my insurance covered. Like the little kid you saw, the full mouth of metal, right? Because they had baby bottle tooth decay. Same thing. You don't want to put a full metal crown in your tooth, or what we call as a porcelain fused to metal, if your gums start receding away from that tooth, that new crown that you just put in your mouth. Because it is a foreign substance, your body will reject it if it doesn't like fake metal, or if it's going to have a reaction against it. Those are the things you want to look at as well. So with the root canal, I wouldn't say that the root canal will cause you to harbor more bacteria, but that crown will. Why? Because our mind says, oh, it's just a fake tooth. I don't have to worry about brushing it or flossing it anymore. Oh, yes, you do. Because you still got your gum tissue. You still have your natural bone. And if anything gets trapped underneath that crown and you didn't take care of that gum tissue or that flossing of that area, food gets in there, it will put that bacteria underneath that crown and start rotting that root, which then that decay begins to spread to the rest of the other teeth.
Okay, thank you. Just a quick announcement. We are not going to open up the platform for anybody who's joined us. If you want to ask a question, if you put your question in the chat, one of us will try and go through it and pull them out and get Travis to give you the best response that he can. So I know that I saw Marie with her hand up. We're not doing it that way for this session. So if you put your question in the chat, we will try and answer it the best we can. So I've got one more. It says, this is from YouTube. Is it possible to repair receding gun lines, which is pulling away, or is it a way to expose the root of your back teeth? If so, how?
Try to sound that question there.
Let me read it again. It says, is it possible to repair a receding gum line, which is pulling away or on its way to exposing the root of your back teeth? If so, how?
Prevention. Get rid of the cause. Is it the brushing? Is it the type of toothbrush you're using? Is it your dexterity, wrist brushing versus bicep brushing, right? Here, small, boom, boom, boom. You see my wrist is doing everything that I needed to do, making sure we're not causing the actual receding of the gums. Why? Because you will see it a lot in the back teeth because we begin to bicep brush. I'm going to get these gums clean. But if we small, like she said, small circular strokes, which then my wrist is doing the small circular strokes for me. So I can't put the bicep in to get in the back because we can't see. But it's okay. Wash your hands, clean, pull your cheek out, look in the back, make sure you're getting it. And at that point in time, I would say if you're having problems with that, get an electric toothbrush, because that would actually help you reduce the amount of bicep actions that you use. Good. So it's the National Health Services here. Okay, got you. So not insurance. So we got insurance. So you guys have one health plan, right? Or something like that. Okay, got you. Yeah. So you just have to see,
the National Health Service will help with you having regular appointments and treatments and so on to a degree. But there is cost. Depending on what you have, there is a cost.
Got it. So now you see there's a cost. So the cost is prevention.
Unless you're unemployed. If you're unemployed, then you can get treatment and there'll be no cost to you directly. But obviously the cost is indirectly by taxes and so on.
Gotcha. Yes. So prevention is key. Floss the ones you want to keep, brush your teeth regularly, at least see your dentist every 6 months or sooner, whichever one you need, and make sure you're eating healthy. And make sure healthy is the relative term. What do you deem healthy? And like you said, somebody spoke to the conversation I had about the meat and the sugar. Trust me, take the challenge, cut it out for 1 week and see how well your teeth do. And all of a sudden, the midline, it begins to shrink. Why? Because those are extra added calories that we use that we really don't need. And it also affects the dental health. The dental health trickles down to everything else. Because if we introduce bacteria here, we can guarantee if we had blood pressure problems, if we had diabetes problems, if we had overweight problems, things like that, all of that is going to be affected. And your week challenge, after that 1 week is over, test yourself. How do I feel? Week 2, let's try it again. All of a sudden, we got our 30 days in, and wow. And that's why I don't believe in folk doing a Daniel fast, because I don't believe in fasting or fast. I call it lifestyle changes, because if we got a lifestyle, I got a future goal. It's not a short term. Lifestyle is long term. And the thing is, if I'm feeling good now, why do I want to go backwards?
Shane, have you got any more questions?
Not at this time, Edgar. No, not at this time.
Okay, there's quite a few comments in the chat, but I don't think they're actually questions.
Yeah, I see one that says, a friend of mine said that they went to the dentist years ago and they shaved the gums. They don't know why, left with bad teeth. Now, that's an interesting question without me seeing x-rays or anything like that. When you're talking about shaving the gums, what we call is hyperplasia, gingivitis, meaning you got an overgrowth of gum tissue. And the gums will actually sometimes, they will overgrow over the tooth, which then can hinder you eating and things like that. And speaking, because your gums have this overgrowth, therefore you have to go and actually keep them shaved down, which the periodontist does all of this to make sure that you got teeth, that's visible. And it could be caused by medications as well. Yeah, so I hope that answered it. And left with bad teeth. I don't know what the bad teeth, I don't know. That's a really, I don't know what that means, but yeah. What does it mean if your teeth is shaking as an adult? When your teeth are shaking, that is periodontal disease, meaning your ligaments, the picture that I showed you, the ligaments that are actually formed in the sockets of your bone, it's bone, ligaments, gum tissue, which are two sitting in there. Once those ligaments are moved away, matter of fact, everybody do this right for me. Take your teeth, hold them together, and you bounce on them together. So you take a few, hold your teeth together and bounce on them. Can you feel how they're moved? They're bouncing up and down. Those are your ligaments. Those ligaments are what, hey, you get that good food and all of a sudden you were chewing so fast, all of a sudden you bit your tongue. Those ligaments is what keeps you from breaking your teeth. Because if you have those ligaments, you'd be like, every time you chew like that, those ligaments is what gives you, it's like your car. Your car has shocks. Every time you hit a pothole, well, you may not have potholes in the UK, but we got potholes in the United States. You know, if your car hit that pothole, that shock takes that absorbance from you. You know, you don't say that boom, hit that pothole. No, it's like a smooth ride. Woo, that was an easy one. That's the shocks. Those ligaments that are in your gums are the same shocks that keep you from breaking off your teeth.
Okay, I think we're getting more comments, and some of the questions are related to what we've answered previously. So I'm just gonna, I've changed, head just changed. I'm just gonna remind people that we do have this on YouTube. So it was recorded from the very beginning. If you missed the beginning, you can go back to, go onto YouTube, type in True Temperance International. Let's see what would also help. If you also put in, what was the title? Put in Travis. Okay.
Your teeth, your mouth, your mouth. Is it in good hands?
Thank you, thank you. But also, even if you just put in True Temperance International, you probably see that close to the top, because there's a huge library of videos on there from the previous shows. So please come on there and share. What's it now? Like, subscribe, and share. Okay, and you will not be disappointed if you miss the beginning to catch the beginning. And also, like I said, you can share with other people, friends and family, and even frenemies. They're the ones who are seeming like they're enemies, but by the time you get to know them, you end up best buddies, possibly even marrying them. And you want your partner to have good teeth. Okay.
Oh yes, quick. I'm glad you said that. Somebody had in the chat about husband and wives. And I talked about the dating a little bit. We want to make sure, and it went with the oral sex as well, that piece, because sometimes I've had wives bring the husbands in. I've had boyfriend, girlfriends bring each other in, and just because they can't speak to the opposite. My husband has bad breath. Can you help him? I don't want to kiss him, or I don't want to kiss her. Those types of things. Because you don't do, we always want to go and let's say premarital counseling. We need to do premarital dentistry. Yes, we need to do premarital dentistry. Why? Because if we're going to go together, if we're going to share together, we got to kiss together. And if we got to kiss together, I want to know what type of mouth you have. Because we don't ask that questions before we say, ooh, I love that person. Oh, they're the finest thing ever. Boom, kiss me. All of a sudden, you get that first kiss. You didn't ask the right questions. And all of a sudden, they had an infected tooth in the back that you didn't see, and it was decayed. Now you just put that bacteria into your mouth. And now, a year, 2, 3 years later, that bacteria running rapid in your body, and it's actually mutating. And now you want to go and have a kid. So now you both just came up with decayed bacteria, formalized through sperm and egg, and now you got a baby coming. Okay, so we always want to make sure that, hey, we going to the dentist together. I want to know your DNA of your teeth. Are you in good hands? Do you have good health in your mouth? Because if your gums are bleeding, like I said, that bleeding is on the signs and symptoms of the bacteria. So that means saliva transmission is you bleeding from person to person. Right?
Okay, but there is hope. There is hope, yes? Because it doesn't mean that the person with the bleeding gums ends up without a partner. There is hope. Okay.
There is hope. That's
go back and watch the beginning of the presentation, and you will see there is help. And also, just to remind you, I have put it in the chat, but not everybody can see the chat, especially those on YouTube. We do have a part 2 coming up in season 2. Okay, we can call it now season 2, because we are going to have a break. Those of you who missed it, we will be having a short break over the month of August, but we will be coming back with lots of new ideas. Obviously, we have a wave 4 of the pandemic coming up, or whatever number wave it's going to be in your area. And we are coming back with lots of information on boosting your immune system. We could be going back over some of the earlier things as well. If you missed it the first time round and you didn't get to watch it on YouTube, some of those things will be revisited, because your health is important, and those of your loved ones too. My husband is now beside me. Maybe he could take over. Shirley. And also we want to run some of the adverts again. Is that okay? But before we do that, I'm sure Ed's going to say something.
There's 3 more questions that I saw. One was private to me. Let me see where it is now. So someone wants to know, you know how you talked about mouthwash, Dr. Travis?
Mm-hmm.
They want to know, is it okay to do it immediately after brushing your teeth? What about the chemical reactions?
There's usually not a chemical reaction after brushing teeth, depending on which mouth rinse you are using. If you have somebody that's holistic, if you want to go to uncleharrys.com, look at that list there. If you have somebody there in the UK or wherever you are in the world that has something that is holistic and using those types of things, using your oils and things like that, there's usually not a chemical reaction unless you're using something, or unless you're using mouth rinse that's heavy in sugar or heavy in alcohol. Just because it has alcohol does not mean, and it burns, does not mean is healthy for you. I had to say that politically correct there. So more people feel the more it burns, the better it's doing. Not always true.
Okay, thank you, Dr. Travis. And there's, I'm not sure if this was mentioned. They said that the line might have dropped off, so they're not sure if it was said, but they have a milk tooth and in the early 30s. The dentist advised against bridging as they didn't want to affect healthy teeth. Is it okay to keep the milk tooth in even though it's a little loose? Should I wait till I have to deal with it? Example, it falls out and it's in the front at the top.
Front is categorized front for 6, front, you know, that's different. But if it's a little loose, let's tighten it up. Meaning floss, brush, mouth rinse, keeping it as clean as possible, using it as less as possible. So if it's in the front tooth, then I definitely wouldn't be trying to eat apples, pears, you know, causing pressure on that area. I'll cut up everything. Remember I said, if something is falling out, we got to alternate a little bit. We got to use our alternatives, motions. So let's tighten it up. Let's get it under control and let's keep it. I've seen people in their 50s and 60s still have their baby teeth still in there. So, but we want to make sure that we stay on top of that. And no, I wouldn't bridge it. Like we talked about earlier, talking about bridging versus implant. So put implant in your mind if you end up losing that tooth, because you don't want to take away 2 natural teeth because I don't know the UK system and how that works is what an implant would cost. But I know here, you're talking about $3,500 for 1 tooth. So you just want to be cognitive of that and take care of it. You know, front 4 teeth, you want to make sure that you're definitely not putting any type of pressure on those teeth. Or you will be, implants on the front, you got to be real careful with those. Or if you're going to bridge it, first 4, go to 6. It's a lot of weight. So they're going to talk about weight and pressures and how the teeth actually move. So there's a lot of chemistry and physics that go into your teeth.
Thank you, Dr. Travis. And there's 2 more. One regarding hydrogen peroxide. Is it okay to rinse their mouth out with it? And the other one is regarding face mask. Someone really wants us to cover that, whether it's to do with bacteria. Where is it?
Does the face mask affect your mouth?
Increase bacteria in your mouth.
Yeah.
So those
Absolutely. Okay, let's deal with hydrogen peroxide first. Yes, it's a chemical, and we don't want to use it every day. It's just like baking soda. You do it and use it every day if you're going to use it. I don't use it, but if you have to use it, I may use it 2, maybe 3 times a week, if that, and it's sparingly. You don't need a lot because it will cause dry mouth. Okay, so that we want to really stay away from. And those who got diabetic medications and blood pressure medications, cholesterol medications, you're probably experiencing some dry mouth. And then you're going to put baking soda on top of that, extra dry mouth. And those are the things that you really want to make sure that you stay on top of and don't overdo it and put your body into a chemical reaction there. But hydrogen peroxide, I wouldn't use hydrogen peroxide with baking soda because if you put them together in a cup, what do? It causes a chemical reaction. And therefore, your gums don't know what it's doing. But all it knows is, hey, there's a reaction going on there, and your gums will start receding. So be careful there. There's another part to that. What did you ask?
Face mask.
Oh, yes, the face mask. If you got bacteria and you put a face mask on, guess what you're going to do? You're going to increase it. Why? Because bacteria likes what? Heat. You don't see mold growing in the cold. Well, yeah, I'm sorry. You do, but it takes longer, like your refrigerator, your food, different things like that. But taking a face mask and holding it on and you're breathing in and out, that's why you see people hang it down a little bit, you know, get some fresh air. And matter of fact, they even said hydrogen peroxide, or no, not hydrogen peroxide, iodine. If you have iodine, get you some iodine and spray your mask and hang it in the sunlight. I've seen that has worked. A lot of naturals here use it, and they say get you some iodine. You get a little like a nasal sprayer, and you spray your mask in and out, and you hang it up in the sunlight to actually disinfect.
Interesting. Thank you.
I did not say masks are not good.
Thank you. Thank you.
Yes.
Thank you, Dr. Travis. I am done with my questions on my side, Edgar. I'm not sure about you, but I don't see any of mine.
I gave somebody asked for my what's. Actually, I did it differently. Hold on. Somebody asked for my WhatsApp number. I was on a direct. Let me do this. There we go. And just know I do a lot. Oh, peppermint oil is good on your mask as well. That's good. Everybody doesn't have, you know. Okay, so your masks are now a choice. Yeah, as long as your mask a choice, I still say wear your mask. Because we have no idea airborne or where and how and what. I'm just cautious at all. And for those that are around me. So
I think we're about there. Sharon, are you still with us? Or are you gone?
No, yeah. I'm here. I'm just standing up. This chair is hurting me.
Okay. Thank you so much for that presentation. Excellent presentation. We look forward to number 2. Are you able to give us a little insight into possibly what number 2 might be?
Yes. Number 2 says, I've done all I can. I've learned about my health. Now what about my dental health? I've been posed with a situation. What's next? And it's the next that we all dread, but we may all know someone who's dealing with it, is oral health and cancer.
Okay, all right, that sounds good. We are going to do a quick advert. We're about to sign off. So we're going to just run the advert. Shelley, can you speak to the advert for me? Just to do what we've done already. Then we're going to have a final thought from the doctor. If there's something that you would, if you had to put it into a sentence, what you would say to somebody that's going to encourage them and pointing them in the right direction. If you could be thinking about that, we're just going to run our adverts so you can get your thoughts together, and then we'll do that, and then I think we're going to close. Shirley?
Hi, I'm here.
Are you still standing up? What are you doing? Or are you laying down? Okay.
Okay, I'm ready.
Okay, the challenge. So what was the challenge again? You're saying no sugar, no meat?
Yes.
Is that the one?
Yes.
We're going to do this for a week. I'm asking everybody that can, if they can do it. And we will, hopefully somebody will be able to testify next week with doing it. Okay, that's the challenge. No sugar, no meat, if you can do it.
Oh. So next week, we are going to have a review of the challenges, and the presenters will be most of the TTI team. So it'll be nice to see all of us together presenting next week as we review the challenges that we've had over the course of the year that we've been running, from cayenne pepper, charcoal poultice, hydrotherapy, no sugar, no processed meat, no meat, exercise, water, deep breathing, fresh air, good salads, smoothies, juices, sleep on time, no media, and there was many, many more. So next week we're not going to do all of them, but we're going to do quite a few of them next week and do some demos as well.
We also did the lemon challenge. Oh
yes, the lemon challenge, and also the punch as well. There was a punch and people were quite with it. So those who may not have been there at the beginning of when we started, come and see as the early challenges that we've had. Okay, so this is for those who are on YouTube. The URL link to join our Telegram group. We haven't put it in the Zoom chat as yet, but this is for those who are on YouTube to join us on our Telegram, where we discuss health issues, health topics, whatever it might be regarding health. It could be with this challenge that Dr. Travis set for us, that we've had for no meat, no sugar. Joan did one last week regarding different health issues and a plan that you might give to somebody, or even for yourself, of how to help it. So we talk about different challenges, people that may face health issues. We talk on there, or maybe privately with that person, then publicly in the chat. And then we have our spiritual group, where we have our devotionals, our words of encouragement, prayers on that platform with our spiritual health. So please take note of it and please join us on there.
And I'm going to just jump in here just a minute. Please take note of the different platforms that we have here, because we are going to have a break. We're going to have a break from the show, so we can kind of get things together and plan and so on. So next week will be the last program, probably for the rest of August, and then we're going to come back in September. Hopefully we're going to come back stronger, and I am blessed being able to do this program. I've met some wonderful people, I've met some wonderful presenters, and I've learned a wealth of knowledge.
Definitely.
I would say it's not always easy to put everything into practice, but somebody has said to me that knowledge is power. Knowledge is power. If you can't do it if you don't know it, but if you know it and you have understanding, it gives you a better chance to actually do it. And the other thing is, there's some forces that are here that are kind of trying to separate us. This us being able to come together, we're not able to do that like how we used to do it before. And I'm really thankful to God that we have this platform, and maybe sometimes we need to look at things with the glass half full and not half empty, because if we didn't have this, we wouldn't have the good doctor here today to give us this wonderful information, and others too. So we've been able to run these programs since the lockdown, and be blessed by having so many people tuning in, and we're really, really grateful, and have so many wonderful presenters that can present to us. And I'm really appreciative of that, and the fact that faithful viewers have been tuning in week by week, because we've gone over a year. Isn't that right, Shirley?
Yes, we have.
We've gone over a year. It's wonderful.
Yes. definitely.
And that's another reason for having a little break. It's been a long, it's been a long time. But God is good, and so we're going to have a break. The plan is to come back stronger, and we're going to start with the immune system. So we'll carry on. Shirley? Oh, I think that's it. Just to thank you. Oh, no, there is some more. Sorry. Go ahead, Shirley.
Yes, so as Edgar said, just to thank you all for your support, from those who've been at the beginning, throughout the whole year, those who just joined on, those who just started today, you still supported us. So we do thank you. Words of encouragement, prayers, donations, sharing with your friends and families. So we do appreciate it from us, from TTI, the team, to now our TTI family. So thank you. Every Tuesday we have at 7 p.m. Our Bible study with Lewis and Alvin, who's a part of the team, and they are going through character building in the sanctuary. So please join us at 7 on a Tuesday. If you're on our Telegram group, it will be posted there, the poster where you have the links to join us on a Tuesday at 7 o'clock. And then on a Thursday at 7, myself, Samantha, Sharon and Alvin, we do an essential oil class. Dr. Travis mentioned regarding bentonite clay, which is a nice clay to use on the teeth. So one of the tips that we'll be using with the oils of how to do it, even natural mouthwash for next week. Sorry, this says hydrate with a twist. So that's what we did Thursday, just gone. Nice flavored water with essential oils. Disclaimer, please do not ingest essential oils that you may have unless you know, but these ones that we use, we can. So this is what we've done. Thursday gone. Thursday coming, we're going to do oral health and essential oils. And then this one is AHR. It's a webinar with Marcia. She spoke 2 weeks ago. Well, I said CBD, but it was actually BCD with burdock, chickweed, cleavers, and dandelion. And she was talking about the benefits of them. It was a good presentation. It is on our YouTube channel, True Temperance International, where she spoke about these herbs, the benefits of them and ways to use them. So Marcy will be speaking on Tuesday, coming, but please get in touch with the AHR team because there is a cost involved. So please get in touch with them. The website is ahreformers.com, or the email is ahreformers@gmail.com. Please get in touch with them and find out more information regarding the cost and so forth and the timings. And then this one is Manor House. Manor House is in the UK, Stoke-on-Trent, and they have another 10-day residential program, August the 29th to September the 8th. And that is boosting your health, preparing you for winter. So as the team TTI is going to be doing when we come back, the immune system, Manor House has got one for the 10-day residential. And we have heard quite a few testimonies when they go to these residential programs. So there is one coming up very soon. And if you'd like to get in contact with them, you can contact Joan. She spoke last week. It's on 079 490 72676. Or you can email at info@manorhousehealth.co.uk. So that is to boost your health and prepare you for winter. So thank you once again, everyone. Thank you, Edgar.
Thank you very much, Shirley. That was our announcements. So I'm going to ask Dr. Travis if he's got a closing thought, something that he would like to encourage us with just before we finish.
My slogan is always spread love, not disease. your mouth, is it in good hands? So I pray that you take with the information that we've shared today. I know it was a lot, but all we got to do is start with a toothbrush and floss daily. Will actually add more health plus your wealth. Because the little things that we can do today will make a big difference tomorrow.
Excellent. My wife has reminded me that that you added another challenge, because of some people were saying about the sugar's not an issue and meat's not an issue.
Oh, that was I told them to walk after every meal 15 to 20 minutes.
Okay.
Because we call it here the itis, which when people want to eat and the first thing they want to do is no. We get up and we walk for 15, 20 minutes, a little brisk walk. Doesn't have to be too much, be around the house, be down the street, a little bit back, and guarantee you most times the sleepiness goes away and you feel more energized to keep going on with your day.
Sure. Okay.
Because you're trying to sleep.
No, we can't say that. Anyway, somebody's just put something in the chat and I'm saying we can't say that. It's I'm not going to say the person, but it's a direct comment to what you just said about not wanting to sleep
after you eat.
So I'm not going to say that, but anyway, that's for that person.
Love the challenge.
Thank you for the presentation.
My pleasure.
And we look forward to you coming again. I'm sure if I was to say all those that are on the Zoom, if you appreciated the presentation, put your thumbs up. I'm sure I would get a lot of thumbs up. And I definitely appreciated the challenge. And I think I need to go and buy another toothbrush and do some other things as well. But thank you very, very much. And look after yourself. Your family, your wife, your children, what's their names?
Yes, my wife, Gianna and Myla Milana. They're not with me here. I did a quick trip here to Georgia, and now I'll be heading back on Monday. So yes, they're in good.
Please give them our regards and the thanks for them loaning us to you for this presentation.
Yes.
Thank you very much.
Yeah, actually, she just finished she just did one yesterday. I forget where she was. She was somewhere. And hers was actually on hypertension and homeschooling.
Okay.
Yeah.
Cool. Very, very good. Right. Well, thank you very much, Travis.
You're welcome.
And we look forward to seeing you again soon.
You guys be blessed. Take care.
Stay blessed. Yeah. Shirley, is there anything else that we need to say, or have we covered it all?
No, I think we've covered it all, Edgar. Just to thank our YouTubers, our YouTube family.
Yes, I'm sure YouTube is going to go off very shortly, so we're going to say goodbye until next week. Please remember the challenges that you mentioned: exercising after you've eaten. What was the other one? No meat.
Yes, no meat
for a week. No sugar, and see how you feel, and maybe somebody will be able to come back and testify to going through that challenge. And next week we will have, what is it? Oh, we're going to do the testimonies through us of the different challenges and things that we've done throughout the year. So maybe all of us will come on, maybe, or most of us will come on and choose a challenge, or definitely encourage you to do something that we've done in the past that we believe is very beneficial to you. But I would just like to thank you all for listening. I don't believe Shirley's got anything else to say.
No.
Thank you for being with us on a week-to-week basis. Please have a good week. The weather's changing here. We had some beautiful sunshine and it's kind of a bit coolish now, but we're still grateful for what we have. So with that, we're going to say goodbye. Goodbye to our YouTubers. We're still going to stay on. If anybody's got any questions, any comments, once we go off air, we will be able to unmute you and you can say hi or goodbye.